Space shapes behaviors. Behaviors create culture, and culture drives results. This is the More Than a Chair podcast by Business Furniture and Choreo, where we're creating space for innovation, for dreamers, and for the next big idea. Welcome to the More Than a Chair podcast by Business Furniture and Choreo. I'm your host, Amanda Clark, and today we are talking about to mask or not to mask. That is the question. As our communities and businesses are slowly phasing into a reopening, many are asking about the importance of wearing masks. Now, leaders are recommending them while some are mandating, leaving us trying to determine what's right and best as we work to keep employees safe and also feeling safe. So let's get to the facts, and we've brought in the experts. Today we have our own Mary Beth Oakes, Business Furniture and Choreo CEO here, as well as Dr. Robin Ledyard, Chief Medical Officer and Indianapolis Region Physician Executive for Community Health Network. Hey guys, I'm so glad you could be here today.
Thanks, Amanda, for having me.
Thank you. Okay, Dr. Ledyard, we are just so happy to have you here and kind of just talk about some of these the facts and what the medical community is saying. Tell me a little bit about masks and why they matter and what some of the information you're sharing right now.
Well, Amanda, I think it's important to probably start with how the disease is transmitted. And that helps, I think, folks determine whether it is a good idea to have on a mask or not. And so what we know is that the virus is it's contracted through contact, meaning that most of the time when you touch your hand to a surface where the virus may be, then you end up touching your face, your mouth, your nose, your eyes, and the virus can be, you can develop COVID-19 through transmission that way. That's the number one form of transmission that we worry about is that contact transmission from your hands to your face. And so the thought on masking, even in the healthcare community, is to protect your nose and protect your mouth. And then a lot of people, in the healthcare community will wear glasses or goggles to protect their eyes. So as we get back out in society, the reason to wear the mask is as you come into contact with folks, and then you touch your hands again, that mask will protect you. It's not as much about, and it protects the person on the other side of you as well, if that makes sense. So if you were to sneeze or cough in the presence of someone else, then your mask protects that person as well. And so, as we get out in society and we're going to be in situations where we don't know where that other person has been, we don't know if they've been exposed to COVID-19, the idea in the grocery store or in our offices, businesses, etc., in wearing a mask is to prevent getting that virus into our nose and our mouth, our eyes, by touching them or allowing the virus to come in that way. Does that make sense?
It does. It does. It's really, what are some of the mistakes that you're seeing people do right now? I mean, I feel like I'm seeing people wearing the mask around their chin or they don't even know how to put it on the right way. I mean, does some of that worry you when we're promoting people to be wearing masks?
It does a lot. If you want to do it right, and if offices, as they open up, are going to ask that their employees do it, I do think it is going to be worth having some instructions around talking about that. As you said, if you're not covering both your nose and your mouth, then the mask is not doing its job. I would say it's as good as not wearing a mask, actually. The other thing that I see is, and again, we've talked about this so many times, how hard it is not to touch your face. And that's actually can be, I think, one of the dangers of wearing a mask. If you don't really try to think, okay, I have this mask on, I'm protecting myself, as opposed to I have this mask on, I'm going to rub my mouth now, or I'm going to adjust something on my face, because that That was one of the reasons early on that we were against masks, because we were so worried that would actually cause people to touch their face more. But I think that risk
Mm-hmm.
benefit, if you do it right, it's worth wearing the mask to protect yourself. But you really have to think of it as, this is a signal not to touch my face.
Yeah. Mary Beth, how are you kind of communicating with employees and other, CEOs in the community about supporting your teams as we're going back into the office, not just physically, but also emotionally when it comes to making some of these decisions?
Well, I think first of all, we've really been trying to focus on safety, right? I mean, we want to make sure that people return to the office and feel safe, and not only physical safety, but that emotional, that mental feeling of being safe. And, what we are trying to express right now to our team is just basically we want to meet them where they are. And we know this isn't going to go on forever. I mean, hopefully it's not going to go on forever. There will be at some day a vaccination and we'll be able to protect ourselves from COVID in different ways. But I know right now, many of our employees, are not able to return to work yet because either they need to stay home with their children, or perhaps they have someone in their household that might be compromised. So if for any reason they have a feeling of not being safe when they return to the office right now, we're encouraging them to continue to work from home. But for those employees that are coming back to the office, we're trying to do everything in our power to help them to feel safe. And we are providing masks, we are providing hand sanitizer, anti anti antibacterial soap,
Mm-hmm.
wipes. I mean, we are really trying to provide extra cleaning and sanitation in our office, and really trying to take every precaution possible to help people to feel safe. And we're even, creating some different space guidelines in terms of how many people can be in a conference room and how many people can be within close proximity to one another in a workstation area. So we're trying to really
Mm-hmm.
put a plan together that's thoughtful, and a plan that's been developed really from all parts of our company. So it's a very much of a cross-functional approach. But I do think you have to go back to meeting people where they are. I mean, like I said, it's not going to go on like this for forever, but hopefully, we can help people to feel
Mm-hmm.
safe in the now time frame. We're trying to look at things in the now and the near and the far. So right now we're in that now phase where people are starting to come back. So we want to meet them where they are and help them to feel safe.
Yeah. Dr. Ledyard, what do you think about some of the plans that companies are making, as far as some of the space and not having as many people in a conference room? Do you think it'll make an impact? And do you think it does help with the emotional health of employees to set some of those guidelines early?
Yeah, I do, Amanda. I think that, as businesses open, they want to think about social distancing. We know that this virus can carry, probably within about 3 to 6 feet. So with the social distancing, we say that it's safe to be 6 foot, 6 feet from someone else
Hmm.
when you're having a conversation or you're working near them. If you need to get closer than that, then you definitely want to make sure that's when you wear a mask. So I think in companies, if you're going to be out of your cubby, out of your office, and walking down a hallway, in the break room, areas like that, in the back, going to the restroom, that's the time when I think companies want to educate their employees about wearing the mask to protect themselves. I also think, to Mary Beth's point, a lot of our employees, I think meeting them where they are, we hear, in our company as well, especially those folks that are working from home now, not in the hospitals, more the administrative side, they want to get back
Hmm.
and see folks. And I do think, again, that's meeting them where they are, but you can't say enough how important it is to focus on safety, as Mary Beth indicated. I think that there will be some emotional um, uplift by bringing people back out, but you want to do it safely. So I think most people realize that. I think most people understand that we now have this disease, as Mary Beth said, until we get a vaccine, we're going to be continuing to think about how we manage, how we try to prevent the spread of this virus, which is, about 10 times more contagious than the flu. and
Mm-hmm.
probably about, 5 times, 10 times more, more serious than the flu in some ways, especially for some of our vulnerable populations. And so
Mm-hmm.
we don't want to continue to spread that. And we're going to have to protect ourselves in different ways, work in different ways, and think about how we can be near each other and have that bonding that we all want, but also about social distancing. It's kind of it's a new era for us, I think, until we get that vaccine where we can feel safe in resuming what we maybe our new normal, so to speak.
Yeah, and Mary Beth knows a lot about this as people are trying to kind of navigate the what's next and looking at their spaces. Some are talking about, and us in the business furniture world are talking about putting up dividers, between spaces, adding screens to desks. Do you think that those make an impact from a health perspective? Does having a screen in front of you, or is it more just smoke and mirrors to make someone feel safe, or can it make an impact?
No, I think it will make an impact. Again, I think that as we work in our spaces, we want that safety factor, as Mary Beth says, and I think having those dividers, having something in between us so we can kind of stay focused, maybe like we have been at home, but still have that camaraderie and be able to see each other's eyes will be important. What I would say to that, though, and Mary Beth can talk about this, and some of the plans is the extra cleaning that will have to come based on COVID-19. And, we've talked about that, whether it is wiping down walls in the hallway. If people are walking and they do touch their hands, you should be responsible for washing your own hands. But I think companies will also probably have a different viewpoint on the environmental services cleaning of the office space, of if you have that divider, that screen divider between an open office concept, how are we cleaning that, et cetera, as we move forward.
Yeah, Mary Beth,
Yeah.
what do you think about the cleaning and the dividers and screens and some of these, changes?
It's really been a mixed response so far. Some of the organizations that
Mm-hmm.
we work with jumped right in and they wanted to start exploring screens. And then other organizations said, we're going to continue to have our employees work from home and then bring them back maybe when there's a different kind of a solution. So for those organizations that are opting for those screens, I do think it's really important to make sure that that's a part of the surfaces that you're cleaning, because obviously that's a great place for germs to build up too. So I think it's all about keeping all of those surfaces clean. I do think the screens can help, but it is about keeping those clean. And something that has also come up, even at someone's desk or someone's workstation, oftentimes, people tend to leave things out on their desks. And so what we have, been talking about with cleaning crews, when those cleaning crews come in, oftentimes they won't clean that desk or clean those surfaces if there are things on that desk. So I think there's going to be some new protocols about that too. And, really having more of that clean desk policy just to make sure that your space can be cleaned daily or however frequently, your spaces are cleaned, right? So I think there's going to be some
Yeah.
new behavior protocols around how do we make sure that we're really, taking those extra precautions to be safe.
Yeah, and I know you two were both just on the webinar this week with the Indie Chamber, and one of the topics that I was not expecting people to ask about as much was just the bathrooms and the cleanliness of the bathrooms and some of those protocols. What surprised you about that, or what do you think about coming and sharing some of those facilities back in the office, Dr. Ledyard?
Um, I think that there is always trepidation about bathrooms, and my
Uh-huh.
my saying on the Indie Chamber um, noon conference, was
Uh-huh.
that, again, this virus is something that you do get from touching your hands and then touching your face, some type of surface that has mucosa, like your eyes, like your nose, like your mouth. And so, we always kind of joke in medicine that you don't get this from sitting on the toilet seat. It's not absorbed through your skin. And so, again, it comes down to having the environment set up in such a way that you don't have to touch as much in the bathroom, right? And so as you
Mm-hmm.
get up and you exit the restroom, we always hope that everyone's always washing your hands, and I think we'll want that more than ever. I think that some offices have great ideas around how we minimize the touch going into the bathroom. And, I know Barry, Beth can talk about what they've thought about multi-stall places, having doors open. Even in the stall, I would encourage folks to, minimize as much as possible how they touch, how they sit down. And then again, can't stress enough the washing of your hands.
Yes, I was just going to say that I know, in doing some client roundtables, the bathroom discussion definitely is a very hot topic. And, one organization, a large organization, they have thousands of employees. They were talking about like hanging some type of a board outside of the restroom that you could hang your employee name badge on to indicate, that you're in the restroom. And what that does for you, it helps someone to understand how many people are already in the restroom. Because I know one idea that company had was to really limit the number of people that go into the restroom at any one time and keeping the door open, as Dr. Ledyard said, so that you get some more air circulation. And then even maybe cordoning off a couple of the stalls, if there are multiple stalls, just so that you can really limit the number of people that actually do go in and use the restroom. So all kinds of things like that are being considered. I know a lot of organizations are starting to invest just in even sensors on the doors so that it opens when you come close. So all kinds of things like that I think will be touchless and help people from not having to touch surfaces that have germs on them, which will be great.
Wow, yeah. Yeah, so many new technologies and changes. I mean, it's really going to be interesting to see. I'm not a fan of the phrase new normal, but it is going to be kind of a new normal, our new workspace, and just seeing what that looks like. Now, Dr. Ledyard, you told me earlier that, even those in the medical field are learning constantly. What are the things the doctors are looking for right now, and scientists to kind of determine, as we're going back, about will the numbers go up, and what are some of the conversations that you're having?
I think, that in the medical field, what we are really trying to pay attention to is what's the prevalence and the incidence of the disease. How, I think that we just aren't sure yet. If you test positive for COVID-19, does that mean that you're going to get the full disease? Does that mean you are just going to spread the disease? So, even the state health department, and I think in the next few months we'll get some good evidence there. The state health department is right now testing about 20,000 people in our state to look and see, do they test positive for COVID-19 or do they have antibodies already? And kind of doing some correlation there so that we know, as I said, so what is the incidence, how much of it is out there or has been out there, and then what's the prevalence, meaning, how many asymptomatic carriers are there. And I think that information will really just help the community in terms of either I have to be more careful, which I'm not saying that we should be less careful, but it will just help, I think, put into perspective. I think the other thing that's so confusing, and until we understand this a little bit better, I don't necessarily think that the scariness of COVID-19 will go away, but we don't quite understand yet all of the reasons why it makes some people so much sicker than others. We know that the elderly, those with certain chronic diseases, are at more risk, but we also see cases of people in their 30s and 40s who get really sick, who may have a stroke or a blood clot of some sort, and we're not sure of the triggers there. And so I think as we learn more science around that and possibly can help people or give medicines faster to certain people who test positive, then I think the public will feel a little bit better. The medical community will feel better. This has been a disease, as you both know, that we mainly have supportive care. That's our treatment. There are some experimental drugs, but I think that the research is still out on how well they work and who they work for. And so until, again, that science, we're more comfortable with that, and again, until we work for a vaccine, then I think that we have to be extremely careful within our work environment, within our social environment, as we continue to open up.
Yeah, Mary Beth, she talks a lot about, fear and some of those comfort levels of people as this continues. What are some of the tools that you're using right now to kind of keep that conversation open with even the teams at Business Furniture and Choreo, and also the teams beyond their clients? I know there's surveys, conversations. What are some of the tools you're using?
Absolutely. I mean, I think we're trying to understand, how do we meet people where they are? And so a lot of the clients
Mm-hmm.
we're working with are surveying their employees to really understand what's working well about remote work, what's not working well, what are they concerned about when they come back to the office. And I think getting that data and that information really helps us as leaders to make much better decisions if we really understand, the point of view of the employee. And so I know a lot of the organizations that we're working with are doing those kinds of things. And it's really paying off because I think the one thing we don't know yet, right? We know that, like, from a technology perspective, we know that working remotely is working, from a technology perspective. I think it's working remarkably well from what I hear from all of the clients that we work with, and just thinking about our own situation. The technology is great. What we don't know yet is what is the long-term impact on the psyche of somebody working at home. What is the
Yeah.
impact of somebody that, feels isolated, doesn't feel like they're connected with their team? What happens to the culture? What happens, as we're trying to work together, but we're not really together? And so I think those are
Mm-hmm.
some of the things we're going to have to pay close attention to, and, really keep having conversations with our employees and getting data about that. Because the one thing we don't want to have happen is to have our cultures erode. There has been such a great emphasis placed on the culture of an organization, especially over the past decade. And we want to make sure to keep the culture strong, right? Whether we're working from home or working back in the office. So I think there's a big opportunity for leaders really to lead by understanding, where are people in this journey and how can we help
Mm-hmm.
them to feel like they're doing their best work and to have the connections that they need. But I do think, I think in the long run, certainly the virtual technology won't replace effectively 100% that face-to-face connection that we all need. So, I think we're all hopeful we
Absolutely.
can return to that to some degree at some point.
Yeah, wow. Yeah. Dr. Ledyard, just as we're trying to kind of gauge where people are, I mean, I'm sure you're aware there's some people that are all in on wearing masks. There are some people that are like, no way. What do you say from a medical standpoint of, like, if someone says, I'm just not comfortable wearing a mask, what would your answer be to them, or some tips on, okay, you don't, so here's what we're going to do? What would you say?
Well, um, what I have said that I hope comes out of this is that we are much more aware of hand hygiene and infection prevention, and that we do take care of each other a little bit more. I mean, adding to Mary Beth's thought is, in the past, we would all power through if we were sick and we needed to come to work. We did it in healthcare even. So you'd have sick doctors working, taking care of patients when we all knew
Mm-hmm.
we probably should have been home. So I think with COVID-19 and that heightened awareness, if you are sick, you should stay home, and we should all support each other in that. That's part of that emotional health, I think, that Mary Beth talks about. So those are
Mm-hmm.
two things that I just hope comes out of this. With the mask thing, I do think that companies probably will have to determine, is this mandated or not, and then try to work through with each employee what that fear may be while they're at work of wearing a mask in public spaces, as I had mentioned earlier. Again, I think, as Mary Beth always says so well, it comes to meeting each employee where they are, trying to
Mm-hmm.
understand their fears about what may be best for the company, for the people around them, and moving forward from there.
Yeah, that sounds like exactly kind of the conversations you're having, right, Mary Beth?
Absolutely. I think that I hope we can all just look at this as probably not something that's going to last forever. Right now, it feels like it's already been forever since we got started down this
Mm-hmm.
path, but it won't last forever. I do believe this too shall pass, right? So I think it's all about helping people to see that there will be an end in sight. It's going to be a different kind of normal. It's going to probably won't be just like what we were used to in the past, right? New norms, new behaviors, new ways of interacting with each other. But I think for the time being, in that now horizon, it just really is about meeting people where they are, and, being very intentional with how we connect with each other, since we can't always see each other face to face. really just being intentional about scheduling time to work with your teams and to even work one-on-one with people and just to maintain those great relationships that we've built over the years. I mean, it's a lot of work and it's a lot of effort, but I feel like in the long run, it's going to pay off if you can meet people where they are and be intentional about maintaining and building those relationships with your team members. And that way, when we do get back to whatever we're getting back to, whatever that looks like, I think our culture can stay strong too. And, our businesses won't suffer. We can keep people safe and we can also, keep our businesses moving forward too.
Yeah, it's so good. Such good information, you guys. I mean, I feel like we could just talk about this forever, and the conversations are going to continue as things continue to change and evolve. So, Dr. Ledyard, thank you so much for being here with us today. We really appreciate it.
Thanks for having me.
And we hope if anybody, if there's anything that you leave after listening to this today, it's knowing to meet people where they are, to try and support and understand each other, and then to wash those hands. So thanks so much for joining us for the More Than a Chair podcast. So thanks so much for joining us for the More Than a Chair